Good morning, and thank you for joining. If you are here today, you are tuning in to Pennie's Community Partner Workgroup for October 2023. We welcome you. For those who don't know me, my name is Maria Ortiz, and I work in operations as a business analyst. I'm here today to help facilitate this session. We hope that you are ready to receive the content that we have prepared for you. So, without further ado, let's dive right into housekeeping items. This call is being conducted and recorded through MS Teams Live. To limit any background noise, we have muted all attendee lines. If you have any questions, feel free to post them in the chat. We have Pennie staff members available to answer any general questions you may have. Customer-specific questions can be answered by calling Pennie's dedicated Assister Broker line at 844-844-4440. That's a lot of fours, right? Just makes it super easy to remember the number. Of course, we don't want to get between you and lunch, so if you need to drop, you can access this recording at a later time by going on agency.pennie.com and clicking on Workgroup. All right, now that we've covered housekeeping items, let's preview today's topics. Next slide. Today, we have a recertification training reminder. We'll talk about customer communication preferences, have discussion around 2024 open enrollment renewals and enrolling due to life events during open enrollment. We will cover target audiences and customer communication, as well as open enrollment marketing campaigns and toolkit. We also have a special message from our executive director, Devin Trolley. And time permitting, we'll address any questions you have in the chat. Next slide, please. So let's dive right into an important reminder. Next slide. For currently Pennie certified assisters and brokers. So if you have not done so already, please complete your 2024 recertification training. Doing so will help you maintain your Pennie certification into the 2024 plan year. As many of you know, recertification training is a yearly requirement. And as the important note indicates on the slide, if training is not completed, consequences will occur. Assisters and brokers who fail to complete the training will be decertified effective December 31st of this year. And if decertification occurs, your customers will be de-designated, unable to be restored. So just keep in mind that our customers need your help to obtain and maintain their coverage. So this is yet another reason why it's so important to complete your 2024 recertification training. The slide provides instruction on where to go to get Pennie certified. Whether you are an assister or a broker, we have provided the hyperlinks for your convenience. We have included several highlights. So if you are a new assister who recently completed 2023 new assister training, you must take the refresher training for 2024 to remain certified. If you are an assister and need help with password login, you can always send an email to the email address that we've listed there for troubleshooting. Let's see, for brokers, if you need assistance with your Train PA account, give us a call at the 844 number listed there on the slide. Applicable to both assisters and brokers. After your 2024 recertification is complete, you can confirm that we have updated the system by looking at the certification end date. We will update this to 12/31/2024 once we have completed and processed your recertification. For more information on certification training, we have listed 2 hyperlinks there at the bottom that you can refer to at a later time. Next slide, please. Let's shift to discussion around customer communication preferences. Next slide. This slide displays Pennie notices and alert options. If you could please raise your virtual hand if you understand the importance of customer education and awareness specific to Pennie notices. It's vital, right? I know you all get it. Being informed enables our customers to act when they need to act, as well as be up to date on their account status. We've seen what happens when customers are unaware of Pennie-generated notices on their account. There's a risk involved, especially because the notices relate to their eligibility and enrollment. So this is why we're covering this topic today, to emphasize the importance of understanding, relaying, and updating notice preferences for your customers. We also have some good to know items on this slide. The Pennie system will automatically default a customer's notice preference to postal mail. This, of course, can be changed to paperless, which we'll see how to do that in upcoming slides. Additionally, Pennie provides the option for customers to opt in to email and text alerts. These would be used to notify the customer whenever a Pennie-generated notice is generated on their account. Focusing in on the chart, the first column shows communication preferences, starting with postal mail. If the communication preference is postal mail, Pennie's going to send a paper notice to the customer through the mail. We're going to also send that notice to the customer's secured inbox. And why do we do this? Well, let's say that a customer loses their paper copy. Say they unknowingly pitched it. All they have to do is just log into their Pennie portal, click into their secured inbox icon, and read the notice. Sending the notices to the secure inbox also provides a benefit to assisters and brokers. Using your Pennie credentials, you can log in, pull up the customer, access their secured inbox, read the notice, and relay the message to help the customer understand the purpose of the notice and what action is needed if applicable. As previously mentioned, Pennie does provide alert features that notifies the customers when a notice has been generated. Just know that these alerts are not required, they are optional. All the customer really has to do is just log in and check a box under their preferences to opt in to receive the alerts, or they can deselect the box if they want to opt out of these alerts. Moving on to paperless notice preferences. With this option, the customer will not receive a paper notice sent through the mail. They will see the notice in their secured inbox, and so will their sister and broker. With this paperless option, the customer must choose one or both alert options because they need to know and be notified when Pennie has sent that notice to the secure inbox so that they can proceed to going in and accessing the notice. Just so you are aware, alert messages do not contain account-specific information. It's just a general notification letting the customer know that a notice has been generated and sent to the secured inbox, and it encourages them to log in to read the notice. Before we leave this slide, it's important to note that these notice preferences can be updated online 24/7, but we also have the Pennie customer service representatives available, and they can make changes on behalf of the customer if needed. So don't forget that we have that service available. Next slide, please. Okay, here we have screenshots of the eligibility application, specifically primary contact information. You'll see that there is a preferred language drop down. Currently, we have English and Spanish selections available. If a customer needs support in another language, they can always call Pennie customer service. They are prompted to choose English, Spanish, or other languages when they call in. We bring this up because we understand that customers, for example, may speak English, but prefer to read their notices in Spanish. And quite honestly, they can be afraid to ask or even embarrassed. So we just want to equip you with the understanding so that you can relay the message and let them know the options that they have available. And on that screenshot towards the middle is the preferred method as far as the notice being postal mail or paperless. The customer would just select the appropriate radio button based on the preference that they want to select. Next slide, please. Okay, so here we are still on the eligibility application, primary contact information section. The screenshots here just illustrate where the customer would go to consent to the text messages, which would be under the mobile phone number field, as well as email alerts, which would be under the email address field. Next slide, please. In the event that the application is already submitted, you can always change the notice preference from the customer's view by clicking on My Preference, which is listed there on the left-hand side. And then once you click on My Preferences, you'll see the fields and be able to check those. Next slide, please. Okay, so let's talk a little bit about Pennie text messages. To keep up with modern technology and, of course, to cater to our customer communication preferences, Pennie has added text message communication as another method of communication during the Medicaid unwinding period. The Department of Human Services has been sending text messages to customers regarding their renewals before they are transferred to Pennie. So far, we've sent over 100,000 text messages. And what we've noticed is that the text messaging has increased our call volume to the contact center, and it's resulted in higher hits to our website, which is great. And we've realized that texting completes the loop on our communication. Towards the bottom of the slide there, you'll see some boxes. We have included those to illustrate the Pennie communication flow. So when the Department of Human Services sends the account transfer to Pennie, we generate a system notice for the customer, and then it's followed by a Pennie email. After the email and before the phone call is where we incorporated the text messages. There on the slide, you'll see 1 through 4. Those are the times approximate when we send the text messages, as well as the message that is included in the text. Know that we also have these translated into Spanish for our Latinx community. Let's see. So people who lost Medicaid coverage, they have 120 days to enroll through Pennie after they lose their medical assistance. During that window is when we send these text messages, just as a reminder that they still need to take action. And once they enroll, they'll drop off of our list and they won't receive these text messages anymore. We recognize that some people prefer email, others are more in tune with their text messages. So we're really just trying to reach people in ways that they want to be reached. If you are working with a customer who is skeptical about consenting to receive text messages, encourage them to try it out. And if they find it's too much, then they can easily turn off those text messages by replying stop to the message that they receive. The contact center, they have scripting where they're constantly checking in to verify what a customer's preference is. So when the customer calls in, the CSR relays, this is the notice preference that you have. Would you like to keep it or would you like to change it? As part of the customer verification process that is in place now, they're also trained on handling people who call in requesting that we stop those unwinding text messages. Lastly, regarding text messages, in case you did not know, the same as you can see notices in a customer secure inbox, you'll be able to see the text messages. So if you click on the secure inbox, it's going to look like your typical notice. Of course, it's going to have the subject line when it was sent, but when you click into it, you'll see that it was a text message that Pennie sent to the inbox. Next slide, please. All right, so next up we have Hannah. who is going to cover 2024 open enrollment renewals. Take it away, Hannah.
Thanks, Marie. Going to the next slide. So as you all know, we are in October, which means we're getting ready for open enrollment to start next month. October is a busy month here because we are in the process of doing all the renewal work to prepare for open enrollment to start on November 1st. So we want to go through that in detail with you all, talk about the process and some things that have changed this year to make sure you're all ready for the start of open enrollment. Let's start off with just talking about who is actually eligible for the renewals that are happening now in October. So we start by looking at all of the current Pennie enrollees who have active coverage in October. So we're actually looking at the folks who have active coverage right now at the beginning of October. There are, of course, customers who enroll after we do this October renewal process, and they've got options too, right? They can always actively shop for a health plan during open enrollment, and then there are some catch-up renewal processes that we do run later in the open enrollment process. But for now, I think it's really important that you all remember that if you are working with someone who is enrolling in 2023 coverage, later in October or into open enrollment, the best thing that you can do is at the same time that you're helping them enroll for 23 coverage, help them enroll in that 24 coverage. That will just ensure that everything is taken care of right at that same time. They have continuous coverage from 23 into 24. And we'll talk more about catch-up auto renewals in upcoming sessions, but there's a variety of reasons that they might not be caught up in those sections. So thinking this process through, really just take that to heart, always looking to do both 23 and 24 shopping at the same time for anyone who's not in this process. Next slide, let's talk about the renewal process. Now that we know that we're talking about current Pennie enrollees as of the beginning of October, let's talk about the eligibility determination process. So the way that works is that we actually create a 2024 renewal application by copying over their current 2023 application. And then we run that through for their eligibility determination for 2024. As with all applications through Pennie, we do have certain rules that we have to check and verify their information against the trusted data sources. So yes, even with the 2024 renewal eligibility determination, they do have the potential to have a DMI. That's the situation where we were not able to verify certain information on their application, and they would have to provide documentation to support what was on their application. So that can happen on renewal eligibility determinations. And you would be able to see what DMIs the customer has, either on their eligibility notices or on their dashboard, just like you would any other time throughout the year. One thing that is new about DMIs for 2024 is we've put in a couple of changes that we think are going to help reduce income DMIs. As you all know, income DMIs are by far the most common data matching issue where customers have to provide documents for verification. So we're always looking on ways to improve that process and minimize. So two things that we're changing for 2024. First is when we go to check the data sources, the IRS is the first data source we use to check income. If the IRS comes back and says that they have absolutely no income data for that person, then we will not generate an income DMI. So we will say, okay, if there's absolutely no data for us to compare against, then we will rely on what the customer attested to on their application, and no income DMI will be generated. Now, if the IRS comes back with information and it is discrepant, it's different than what's on their application within the certain thresholds, we may still have to generate an income DMI. But this will eliminate some scenarios where the only reason they're getting a DMI is that we literally don't have a data source to be able to compare against. Okay. The other scenario that other way that we're working to reduce income DMIs for 24 is we are looking back to see if the customer recently provided documents to verify their income for that same amount. So if, let's say, the customer in March provided documents, March of 2023, provided documents to verify their income of $35,000, and we resolve their 2023 income DMI. When we go to submit their 24 renewal application, they still have $35,000. We see that they've already provided us documents for that same amount just recently, a few months earlier. In that case, we would not generate a new income DMI for 2024, okay? Because they have already pretty recently provided us documents supporting that amount. Now, if the income amount is different or anything else, they could still end up with an income DMI. We're excited. I think these two things are going to see a decent decrease in the amount of income DMIs, but there will still be scenarios where folks will have them. So keep an eye out for that on the eligibility notice and the customer's dashboard. Let's talk about with these renewal eligibility determinations, can someone be found potentially eligible for Medicaid or CHIP on their auto renewal eligibility? And the answer is no. When we run just the renewal eligibility determination process, the current Pennie enrollees are always going to be found eligible for marketplace coverage. We're not going to find somebody's renewal eligibility to say they're eligible for Medicaid or CHIP. But Medicaid and CHIP are not completely out of the picture, because sometimes we'll see that the person's renewal income is now, within the Medicaid eligibility range. So they would be renewed as eligible for marketplace coverage, just like anyone else. But we have a separate process that happens in early November, where we will send that application over to DHS for a full determination of that person's potential eligibility for Medicaid or CHIP. If Medicaid and DHS returns the application and says, nope, they're not eligible for Medicaid or CHIP, then there's no impact to the customer. They are continuing their Pennie coverage as usual. However, if DHS does come back and say, actually, you're right, this person is eligible for Medicaid or CHIP, and we've enrolled them, then when that happens, we would then prospectively terminate their Pennie coverage. So let's say that we auto renew them on November 1st, and then in, let's say, late January, we get Medicaid decides, yes, this person is eligible for Medicaid coverage. We would then terminate their Pennie renewal coverage January 31st. So prospective to the end of that month. So this ensures that everybody who's currently enrolled will have in Pennie coverage, will have a Pennie auto renewal. Even though some of those folks are now close to that Medicaid eligibility, we're still going to check on that, but they will have Pennie coverage while we are checking on their Medicaid or CHIP eligibility. Okay. There's other scenarios where you might have a customer who is currently enrolled in Pennie coverage with APTC, where they are renewed without APTC. That can happen. Probably the most common scenario that causes that to happen is when the customer did not provide consent for us to check their trusted data sources at renewal. So on the signature page for every application, there's a separate question that asks about consent to check data sources at renewal. You can give up to 5 years of consent. Every year that we rely on that consent, your number of years consent decreases down. So you could either have, the customer may have never provided us consent to check the data sources at renewal, or they may have provided us with that consent in a previous year, but we've now used up all of the years of their consent. So just because somebody had provided consent in the past and was auto renewed doesn't mean that their consent their consent could have expired for 24. So that can happen. And in that scenario, all the customers to do is just update their 24 application and get an eligibility determination for financial assistance. And then any APTC would automatically be applied to their plan. It's pretty straightforward. This is a good reminder, though, when you are helping customers throughout the year, it's a good idea to double check and make sure that that renewal consent is updated. So if they want to keep that renewal consent, they can just update the number of years that they're authorizing at any point when they're submitting an application. That'll ensure that they don't inadvertently sort of run out of the years that they've already provided for. Okay. Next slide. Another big change that happens every year as part of our renewal eligibility determinations is that we update the federal poverty levels that we use to determine someone's eligibility for financial assistance through Pennie. So for 2024, Pennie uses the current most recent federal poverty levels, which is actually the 2023 federal poverty levels. The 24 federal poverty levels don't come out usually until like late January. So that means that when we copy the person's income from their 23 application to their 24 application, the dollar amount may be the same, but their federal poverty level percentage will be different because their 23 application was using the 2022 federal poverty levels, and the 24 application is using 23 federal poverty levels. So take the example here. We've got a household size of 1, annual income of $35,000. So on their 23 application, that resulted in 257% of federal poverty level. So that person was eligible for APTC, but no CSR. That same 35,000 on their 24 renewal application would result in a 240% of federal poverty level, and which then would be APTC with CSR, with cost sharing reductions. So that same dollar amount ends up with different federal poverty levels, which is why you can see people changing from different CSR levels or being newly eligible for CSR, or from being just over Medicaid and CHIP thresholds in 23, but now being below Medicaid and CHIP thresholds for 24. So we have updated this chart. It's a chart that we've shared in previous years for some of the common eligibility thresholds for Medicaid, CHIP, and some exchange programs. Medicaid and CHIP eligibility rules, if you recall, back in March, we do update the federal poverty levels for Medicaid and CHIP. So the only thing that's updated here is actually the federal poverty levels for the exchange programs. Okay. We'll talk more about cost sharing reductions in a few slides here, but last reminder is that Medicaid and CHIP eligibility is based on your current monthly income, not your annual income. So you can end up having two different federal poverty levels because your annual income might be one amount, but then if you look at your current monthly income, it could be different. Okay, so just always keep that in mind when you're thinking about where somebody falls in terms of their federal poverty level. The Medicaid and CHIP ones can be different amounts because of that monthly piece. Okay, next slide. Okay, so now that we've made the renewal eligibility determinations, we can actually generate the renewal enrollments. This process is relatively straightforward. Every year we renew them into the same or a comparable plan for 2024. There is one new scenario that we'll talk about in a minute where some people might be enrolled from bronze into silver. So we'll go into that in details in a moment, but general renewed into the same or comparable plan. As you know, premiums and APTC change every year. Those changes vary by the plan you're in and by county. APTC changes an important change for a couple of different reasons. One is because of the change to the second lowest cost silver plan. So everybody can kind of understand that the premiums for whatever plan that you're enrolled in will change every year based on what those premiums change, right? It might be a 2% increase, a 2% decrease, whatever it might be. APTC changes people often find confusing because it's based on changes to other plans that are available in your county, which is your service area. Plus, the other thing that will have a big impact on your APTC is what your new 2024 federal poverty level is. Remember, we just talked about how the same dollar amount of income year over year will result in a different federal poverty level percentage. That percentage of federal poverty level impacts the APTC calculations. Okay. So APTC calculations changes have a lot of different impacts there, but both change for different reasons each year. We do automatically apply APTC to everyone's renewal enrollment. So we will apply 100% of whatever they're eligible for to their renewal enrollment. One exception to that, and this is a small population, but it's an important scenario for customers who are currently enrolled in 23 coverage and they're eligible for APTC, but they've used that slider to elect to use $0 of their APTC. For those folks, we do carry that election over into 24. So we will also apply $0 of whatever APTC they're eligible for to their 2024 renewal enrollment. Now, they're still eligible for more APTC, they could go into their account and adjust the slider if they wanted to apply APTC to their 24 renewal enrollment. But those folks, we do carry forward that $0 election from their 23 plan into their 24 renewal plan. Almost everyone else, the vast majority of folks, are just having 100% of their eligible APTC applied to their renewal enrollment automatically. There's a couple of scenarios where someone may not have a renewal enrollment. For the last several years, Pennie has seen renewal rates at 98, 99%. So the vast majority of current enrollees will have a renewal enrollment. But probably the two most common reasons someone does not have a renewal enrollment is that they were enrolled after we started running renewals in October. So maybe they enrolled for the first time in November, or maybe the family's been enrolled for the whole year of 23, but they added a family member in later in the year, November or something. So those folks may not have a renewal enrollment. The other scenario is, of course, children who have turned age 26 in 2023. Those kids are gonna age off of their parents' health plan for 24. So their notice will say that this child was not able to be renewed and that they'll need to enroll in their own policy if they want coverage for 24. Go ahead and go to the next slide, and let's talk a little bit about this new bronze to silver renewal enrollment scenario for this year. So for 2024, we are going to look at some customers who are currently enrolled in bronze plans, and we'll compare and say, okay, what happens if what's their cost to enroll in their renewal bronze plan for 24? And we'll figure out what that net premium is. If that person's also eligible for cost sharing reductions, we'll then compare the cost of renewing them into their bronze plan to what their net premium would be if we renewed them into the corresponding silver CSR plan. So throwing out numbers, let's say it's $10 to net premium to renew into their bronze plan, and it's $5 to renew into a silver CSR plan. Well, in that case, because it is the same or less, so it's no more expensive to put them into that silver plan that has richer benefits, those folks will be renewed into the silver CSR plan instead of a bronze plan. It's still going to be the same product type, same product network as their bronze plan, but they're moving them up a metal level so that they can leverage those cost sharing reduction benefits. So why would we do this? And the reason is because the cost sharing reduction benefits are a really important part of someone's financial savings, and folks, this would allow the customer to maximize using that cost sharing reductions while not costing them any more premium out of pocket every month. If when we did the comparison, if it was, I think I said it was $10 to renew into the bronze plan, but it would be $15 to renew into the corresponding silver cost sharing reduction plan, well, that would be an increase in their net premium. We won't automatically renew them into that plan. Okay. They may want to consider enrolling in that plan, but we won't automatically renew them into that. There is another scenario where we would automatically enroll somebody into a silver cost sharing reduction plan who's not currently in one. And that would be someone who is in 23 enrolled in a silver plan but not eligible for cost sharing reductions. And then their income for 24 makes them eligible for cost sharing reductions. Whenever someone's enrolled in a silver plan and they become newly eligible for cost sharing reductions, we automatically move them into that corresponding cost sharing reduction version of their current silver plan. That happens at renewal, that happens throughout the year, right? But if somebody is not currently enrolled in a silver plan outside of this new renewal process, they don't automatically get to benefit from that cost sharing reduction eligibility unless they actively make a plan change. So a couple of screenshots below just to remind you how you can tell what plans are cost sharing reduction eligible. You see there's a filter. If someone is eligible for cost sharing reduction plans, you'll see that filter checkbox in your plan shopping. You'll also see on the plan tiles that where it would normally say silver and then the plan type, like a PPO, EPO, whatever. If they're eligible for cost sharing reductions, you'll also see that little CSR emblem right next to it on the plan tile. And that lets you know that these are cost sharing reduction versions of these silver plans. So go to the next slide and let's just refresh on what a silver cost sharing reduction plans are. So a standard silver plan has the actuarial value says that the insurance pays approximately 70% of all of the healthcare cost of healthcare services, and the customer pays approximately 30%. And the customer pays for that through things like deductibles, co-pays, co-insurance, right? Those out-of-pocket expenses, not premiums. Cost sharing reductions have nothing to do with premiums. The cost sharing reduction says that you'll take that base standard silver plan and increase the amount that the insurance will cover and decrease the amount that the customer would pay. So as you see in the chart, you start with at the top with your basic silver plan, and then as you get to the first level of cost share reduction, which is that CS4, you see that, okay, the plan starts to pay 73%, the customers only pay 27%. So those are pretty similar, but there is still some savings to customers. The bigger savings you start to see with the next level, CS5, you're now at the customer paying only 13% of the overall on average for the cost for healthcare services, or even at a CS6, that maximum level of cost share reduction. In that case, the customer's only paying 6% of the overall cost for services. What that means is the silver cost sharing reduction plans allow the customer to pay for a silver premiums, but get benefits that are potentially better than even a gold or a platinum plan, right? That CS5 plan, that actuarial value is richer than a gold plan. The CS6 is actually richer than a platinum plan. That's why it's really important that customers who are eligible for cost sharing reductions understand why that is such a benefit to them, and it's really valuable for them to be enrolled in those plans. We find that people just don't really understand CSR plans, and so they're not this new policy of renewing people from bronze into a silver CSR plan when there's no additional cost is really to help make sure that they are leveraging this, big savings for them. Next slide. Okay, notices. You heard Marie talk all about why it's really important they get notice. People get their notices and how they can get their notices. Quickly, for Pennie, we give 2 notices, a renewal notice about who's been enrolled, what plan, how much it's going to cost, their eligibility for 24. Those notices are going to be available in their secure inboxes before 11/1. If they've elected postal mail, they go in the mail. They'll receive them on or around 11/1. They might get them a few days later. It just depends on mail service. Insurers also send a renewal notice, which has information about their renewal plan, details about changes to benefits, etc. They will get notices from the insurer, again, on or around 11/1. They might get it a few days after open enrollment begins. Okay. Lots of other communications that happen throughout open enrollment. We'll talk more about those later on. Okay. Next slide. Now that open enrollment finally begins on November 1st. All of that stuff that happened before is all happening in October. Open enrollment begins on November 1st, and you'll notice for this year only, open enrollment, instead of going through January 15th of 24, it's actually going to end on January 19th of 2024. And this is because January 15th is a holiday, so it's a Monday holiday of a 3-day weekend. So we've extended open enrollment through Friday of that week, so Friday, January 19th. You'll see when we our notices, et cetera, at the beginning of open, we're just going to stick with the normal dates that everybody's familiar with, November 1 through January 15th. The extended deadline is going to be announced after we get past December 15th, because really from November 1st through December 15th, the real focus and messaging is about get enrolled by December 15th to enroll for 1/1 coverage. Only after December 15th do we start talking about open enrollment into January. So that's when you'll see announcements from us about the extension. Catch up auto renewals, those things will happen for folks who were not part of this October renewal process. We're going to talk about those more in an upcoming session. And then lastly, remember that we do not automatically apply changes from 2023 to 2024 plan year. So let's say you go in during open enrollment and you update your income on 2023 application. you need to make that same update to 24 application. Or you add a family member into your 23 application, you need to add them to 24 application. Just remember to always make those changes under both plan years. And we're going to talk about that more in a minute. Next slide. Two other quick updates around changes for 24. The affordability threshold for employer-sponsored insurance is updated for 2024. This is says that if the cost of someone has access to employer coverage and it costs more than this year, it's going to be 8.39% of their household income, then that employer coverage is considered unaffordable and they may be eligible for financial assistance through Pennie. This is a decrease that for 23, the percentage was 9.12%. We have a ton of information about how to calculate affordability for employer-sponsored insurance. We went through that in detail back in our December 22 work group. So if you have any questions on that, how to calculate affordability for employees, for the family members of the employee, go check out that work group. And then another thing we wanted to cover that is going to work a little bit differently in 24 is how we handle sending applications to Medicaid. So if you submit an application for financial assistance, the first thing we have to do is check, is that person eligible for Medicaid or CHIP? And if they are, then we have to send their application to DHS for a determination before we can consider whether they're eligible for APTC or CSR. There's an exception to that, which says if the person was recently denied Medicaid or CHIP, and the rule of recently means in the last 90 days, then we can skip sending their application to DHS and just immediately go and look at their eligibility for APTC and CSR. And that's because they were recently denied. That's a very fresh denial. We don't need to keep resending it to DHS every time, as long as that was a very recent denial. But if you were denied for Medicaid or CHIP 2 years ago, something like that, or a year ago, or 6 months ago, that is not a recent denial. That means that if you were denied 6 months ago and you reapply and you are still within Medicaid or CHIP eligibility thresholds, we will have to send that application to DHS for a renewed determination of whether you're eligible for Medicaid or CHIP. And then only once we get a denial could we then consider their eligibility for APTC and CSR. So when you are working on applications, you'll see there's a question on there about a recent Medicaid denials. It has a date on there. Look for that date being in the past 90 days. If it's more than 90 days in the past, then it's like they've never been denied. We need to go check their eligibility again. Next slide. An exciting update for 24. You may have seen this. PID issued a press release. I think that was just last week. There's a few plan changes for some folks in different counties are going to have access to new insurers and through Pennie. So some of these are insurers who currently offer plans through Pennie who've expanded to certain service areas. So Geisinger, you'll see, is going to be offering plans in Bedford County. Most of the changes on the medical side are actually happening in Southeast PA. So you'll see that Highmark is going to be in those 5 Southeast PA counties: Buckchester, Delaware, and Montgomery, and Philadelphia. So they're going to be newly offering plans there. And then we have a brand new medical insurer on Pennie for 2024. Jefferson Health Plan is going to be offering plans in 3 of the Southeast PA counties as well: Bucks, Montgomery, and Philadelphia. Jefferson Health Plan is currently has Medicaid. Some folks know them from the Medicaid side, but this is their first time offering QHPs through Pennie. We also have a new dental insurer. Solstice is new to Pennie, and they're offering standalone dental plans in a number of counties throughout the state. So just a few changes, and of course, insurers who are currently offering plans in the same counties have new plans, changes to their plans, etc. So take a look at those. Next slide. So we've talked about all the things that we're doing during open enrollment, getting ready for open enrollment, and during open enrollment. Just a reminder on some of the things that you should be doing during open enrollment as Pennie certified assisters and brokers. Checking in with your current Pennie customers to see what's changed for them. There may be changes that impact their eligibility, their health needs. Review what changes there are based on their auto renewal. There's going to be cost changes. They may ask questions about why premiums or APTC has changed. And then they'll need to assess whether they want to shop for a new plan or stay enrolled in their renewal plan. Do they have change to their healthcare needs or different providers? If they're eligible for CSR and they're enrolled in a bronze plan, should they consider enrolling in a silver CSR plan? Do they want to add dental coverage, look at new plans from new insurers, et cetera? A lot of different considerations to make. You are there to help them with those considerations. And then don't forget to update their application to make sure they're getting the correct eligibility for 24. So do they expect their income to be different for 24? Need to make updates to that. Have they had access to new other coverage that they need to update on their application? Do they need to update their communication preference? They no longer want postal mail, they want to get electronic, just messages through secure mail. And then remember, if a customer has been auto renewed for 24, but they don't want that coverage, they do need to cancel that auto renewal by December 31st, or else they may be responsible for some premiums for that 24 coverage. It's not going to just automatically go away. So don't forget that that is in their notices, but we do see people every year kind of think, well, I just thought I didn't need it, so I would just kind of let it go and it would go away, and then they get surprised later. Then, of course, don't forget community outreach to the uninsured and historically marginalized and underserved populations. We are still well into the unwinding. There's a lot of folks who are losing Medicaid coverage that continues into 24, and those folks need help. And if you want more information on working with some of these uninsured populations, marginalized and underserved populations, don't forget to go back and check out your DEI modules from your trainings. That has a lot of really good resources on working with different populations and different needs for those folks. Moving forward, want to preview, go ahead, next slide. And next one after that. We're going to talk very briefly about enrolling in with a life event during open enrollment. We're going to spend a lot more time talking about this next month. We wanted to give a bit of a preview on this so that you're ready for these questions going into OE. So we have customers, right? They can experience a life event anytime during the year. Sometimes that means that their life event's occurring during open enrollment. And those folks end up with an SEP that overlaps with open enrollment, and they get confused about kind of how to shop, to get the right desired coverage start dates. Unwinding is even worse, even more confusing, right? Because they have this really long shopping period of 120 days that may overlap with open enrollment. Plus, they have the ability to do a retro start date if they enroll in the first 60 days. So we wanted to just show a couple of examples of what you should be thinking about when you're helping somebody with a life event during open enrollment, and in particular using these loss of Medicaid folks, so we can talk about those considerations. So go ahead and go forward. I think 2 slides. So one more. When we're talking about how to shop for these folks, you need to look at both their SEP and open enrollment and figure out what are their options for coverage start dates so you can give them and maximize their enrollments. So got a quick example here of somebody who lost their Medicaid on 10/31. So they've got shopping for their SEP through the end of February, which overlaps completely with open enrollment. So if we go to the next slide, if the customer comes in and let's say we're shopping in November, so they're in their first month of their SEP, then to maximize their coverage, you would be enrolling them through their SEP for 23 because they're still in that first 60 days. So they can enroll back to their loss of Medicaid coverage. As soon as you know that somebody is in that first 60 days of their loss of Medicaid, you need to always be thinking about enrolling them in through the SEP to get that earlier coverage start date option. Then, because this is going to enroll them back to 23 coverage, we need to remember to enroll them for 24 coverage. So you can submit the 24 application. It will automatically copy it over from 23 if they don't already have one. And then you can either report an SEP, or in this case, for the 24 coverage, you can just enroll like anyone else through open enrollment because they're going to get a 1/1 effective date either way for 2024. So you need to be thinking, what's the earliest coverage start date that they can get? And do I need to do the enroll them in both 23 and 24? If they have an SEP, you want to almost always report that SEP. That's going to get them likely a better effective date, or at worst, the same effective date than if they were shopping for open enrollment. Okay. So go ahead and go forward one more slide. Thanks. So here's an example. Now we're in late December. So we're still within their first 60 days of their SEP, so we can still get that retro start date using their to ensure there's no gap in coverage after Medicaid. But we're after December 15th. So if we were to shop as if it was open enrollment, we'd only be getting a 2/1 start date. That would leave them with no coverage for January. So remember, if they have an SEP during OE, you're almost always going to be better off reporting the SEP. And in this case, you report that SEP and you're going to be able to shop for 1/1/24 coverage. So those are things that you need to be thinking of as you're helping anyone with an SEP during OE. What's the SEP options available to them, and how do I report that on both the 23 and 24 to get them the most comprehensive coverage, ideally to result in no gap in coverage. Go ahead and go to the next slide. Basically the same things will apply, but in this case, now that they're after more than 60 days into their SEP, they don't have the option for the earlier coverage start date. So all they can do is enroll prospectively, and they will have a gap in coverage, but they could still enroll because they have both an SEP and an OE. And then next one, if they are shopping after the OE is over, again, you'd report the SEP and you can just shop prospectively because they're after their first 60 days. So last slide, just a few points to be thinking about, and we're going to go into we can talk about this a lot more in our next session. Do they have a qualifying life event? And if so, what is the earliest coverage start date that life event gives them? If it's going to be an earlier date than open enrollment, you've got to report that life event, and that's going to give them the shopping that they need. And if you're not sure, report the life event, and worst cases, you get the same effective date. And again, the changes to your 23 coverage are not going to automatically apply to 24. So you should always be reporting both changes to both plan years to be sure that everything is covered. So we'll go through more of this in November and a lot more detail, more examples. Wanted to get you thinking about those things, at least with the start, and in particular with the unwinding happening. You can go to the next slide. I'm going to hand it over to Kelsey to talk more about customer communications and outreach activities during open enrollment.
Thank you, Hannah. Good morning, everyone. I'm Kelsey Cameron, Marketing Communications Manager here at Pennie. So just quickly going over our open enrollment plans for communications and marketing. So starting with customer communications and our target audiences, as mentioned earlier, our tactics for outreach to our customers, our emails. We have also the outbound calls, which are going to be on a priority list. And then new this open enrollment period, we will be putting in text messaging as well for marketing awareness and notices for some of these different campaigns. I also just want to note that the unwinding campaigns that we have been doing will continue throughout these months as well. But in terms of OEP, stakeholders will be letting everybody know about our OEP stakeholder toolkit, which I'll talk about in a later slide. OEP customer communications, we will be providing our stakeholders high-level details of our communications to our customers, which are going to be these next two groups that I talk about. And then also we'll be letting our stakeholders know throughout OEP about our different deadlines. Current customers, we're going to be letting our customers know who are auto-renewed, that the notices are in the mail and they should check them out. We'll also let all of our customers know when OEP has arrived, if they can come in if they so wish to shop around. Any actions needed for our customers. Some examples of those are auto renewals and then any catch-up runs, but then also those who are in a bronze plan and could buy up to a silver letter plan if they're CSR eligible. So we'll be just hitting customers a little bit with anybody who could take action throughout open enrollment. And then also potential customers. So we have emails for submitted applications and open applications. So we will be emailing them throughout open enrollment, letting them know open enrollment is here and they can just finish the process and enroll in a plan. We also have some contacts for community partners that we'll be messaging as well. And then letting everybody know about daily we'll do like a 5-day reminder up into each of the different deadlines. So that's our high level plan for customer communications. More details will be shared shortly. And then going into open enrollment marketing campaigns and our toolkit, in terms of owned media, our customer comms, which I just talked about in the last slide, our stakeholder toolkit, which I'll talk about in the slide coming up. We will also be updating our website from OEP is coming to OEP is here, directing customers to the shopping portal. Our social media, we'll make sure that we'll be blasting out open enrollment campaigns, and we'll also have a Pennie newsletter that goes to all enrolled customers as well as our stakeholders in November. Earned media, will be hosting several press conferences and putting out press releases during open enrollment, one probably around the beginning of open enrollment period, and then also around the different deadlines. And leading up to the deadlines, we'll also be doing media interviews, reaching out and getting into different publications and different stations, really spreading the word about open enrollment. And then just a little hit on our paid media and creative campaigns. So heavily focusing on the Southeast Pennsylvania this year, because we know that that is the largest numbers of uninsured, really focusing on large and medium metropolitan areas, as well as, of course, statewide coverage for our paid media. Different tactics include search and social. We're even looking into using social influencers again this year. We'll have TV campaigns, radio ads. We'll have transit ads as we've done in the past in Philly and Pittsburgh. And then also pharmacy advertisements in pharmacies, local laundromats, grocery stores. We'll also have a radio spots for football with the Steelers and the Eagles. And we're going to have print ads in various community publications and then also event sponsorships. And our creative focus this year is really like the value and the feeling that comes with health coverage, really focusing on the importance of having health coverage, showcasing Pennie as a trusted source, and that Pennie is the place for the lowest costs on high quality coverage. So just also touching quickly now on our Pennie Stakeholder Toolkit, which will be coming soon. So look out for it. We'll include updated collateral materials, also some specific targeted collateral this year. All of those collateral materials will be translated into Spanish. We'll also have sample social content and social graphics and animations that you can use on your sites. And of course, stakeholder talking points, and then we'll also include sample newsletter language should any stakeholder want to use that for their newsletter publications. So that's pretty much a little bit of an overview for our marketing and communications plans for open enrollment. And now I'm going to turn it over to our executive director, Devin, for a few words.
Thanks, Kelsey, and thank you everyone for joining today, and hopefully you found the information helpful. For those of you who have worked with Pennie in the past years, you know what a big deal open enrollment is. It is the time of year to help anyone without coverage to enroll for 2024 and to make sure that anyone already enrolled still has the best coverage for their needs. This open enrollment in particular will be unique in that we will also continue to have a lot of activity of individuals being transferred over from Medicaid. For those Pennsylvanians who are still uninsured, we hope that you look around your communities to see who may not have coverage and help them get connected to Pennie. Especially with the recent redeterminations happening with medical assistance, there may be individuals who have lost coverage this year and missed their opportunity to enroll through the special enrollment period. Extra effort to conduct outreach to these and other individuals who may not have coverage would be especially valuable this year. Pennie has made great strides to increase awareness of our affordable coverage options, but we still find that many people who could qualify for lower costs are not aware of them and not enrolled. We need and appreciate the efforts of community members like yourselves in helping get the word out about Pennie. As you all know, Pennie is the only place to get financial help to lower the cost of coverage and care, but it also comes with an important quality guarantee that coverage outside of Pennie doesn't have. All health plans through Pennie must cover care for pre-existing conditions and a full set of medical services, as well as providing meaningful financial protection to consumers who have significant health needs. In the event of a serious or catastrophic injury, being covered through a Pennie plan means that the amount a person pays is capped each year. In contrast, health plans outside of Pennie often can have coverage exclusions and don't cover full benefits, leaving individuals with high medical bills. Please be sure that anyone you are working with has this important information, as well as understands the benefits of being insured. Having coverage through Pennie can provide peace of mind to individuals. By the time someone gets sick or injured, it can be too late to get the necessary coverage. Enrolling during open enrollment means protection no matter what happens in 2024. We find that it's also helpful to point out to individuals that having health coverage provides free access to important preventive services like immunizations, wellness visits, and screenings that can identify health concerns and prevent them from becoming more serious. We ask that you take the next couple of weeks to prepare yourselves and your customers for the open enrollment period. A few reminders for once it starts November 1st. Make sure current enrollees update their information if it's changed. Check both coverage years for anyone who enrolls between now and the end of the year to confirm coverage. And keep an eye out for opportunities to enroll those who do not currently have coverage. We are looking forward to a busy season and thank each of you for your work to help Pennsylvanians find high quality coverage at the lowest cost through Pennie. The work that you all do within your communities helps make our communities and neighborhoods throughout Pennsylvania healthier. Thank you so much for joining us today and hope you all have a great time preparing for open enrollment.
Thank you, Devin. All right, so that wraps up our presentation. We are at time, but no worries. In addition to posting this recording to the website agency.pennie.com under Workgroup, we also will upload the Q&As from this session for your reference at a later time. I want to give a special thank you to my peers for their participation today, but also to the audience. You all get a shout out as well. Thank you for your time and for caring enough to join us today. There on the slide, you have a customer service contact number as well as ours. If you have questions, feel free to give us a call. If you prefer not to call, you can always just log in and create a ticket with your inquiry, and customer service representatives will respond to your ticket. Feedback is always welcome, so thank you very much for your time. Have a great weekend. Take care. Until next time.